cause of death was multiple gunshot wounds to the head. The immediate damaging effect of a gunshot wound is typically severe bleeding and with the potential for hypovolemic shock, a condition characterized by inadequate delivery of oxygen to vital organs. In the case of traumatic hypovolemic shock, this failure of adequate oxygen delivery is due to blood loss, as blood is the means of delivering oxygen to the body's constituent parts. Devastating effects can result when a bullet strikes a vital organ such as heart, lungs, or liver, or damages a component of the central nervous system such as the spinal cord or brain. Common causes of death following gunshot injury include bleeding, hypoxia caused by pneumothorax, catastrophic injury to the heart and larger blood vessels, and damage to the brain or central nervous system. Non-fatal gunshot wounds frequently have severe and long-lasting effects, typically some form of major disfigurement and/or permanently disability. Introduction. The case was primarily about the autopsy report of the 24-year-old male due to multiple gunshot wounds to the head. The said person was passionately into cockfighting together with his comrade Aubrey. The loss during cockfight caused the tarnish of their relationship, leading to his assassination. Considering the high incidence of deaths caused by firearms, forensic pathologists must possess a thorough understanding of the patterns of injuries caused by these weapons. During the autopsy, the preceptor checked for bruises in the patient's body and performed incision for the retrieval of bullet, mainly in the head. The bullet in the head was retrieved. Another open incision was performed in the body to check for possible bullets. No bullets were retrieved. Management goals should focus on early aggressive, vigorous resuscitation and correction of coagulopathy. Those with stable vital signs undergo brain-computed tomography scan or CT scan. Neuroimaging is vital for surgical purposes, especially for determining the type of surgery, size and location of the approach, and the route of extraction of the foreign body. However, it is not always surgical management is indicated. There is also the not uncommon decision to choose non-surgical management. The treatment consists of immediate salvage through control of persistent bleeding and cerebral decompression, and restoration of anatomic structures through the hermetic seal of dura and scalp. There are possible conditions experienced by gunshot patient if medical intervention is successful. In 1944, a resident in Louisiana was shot by a bullet that entered her forehead and exited the backside of her neck. She suffered a stroke that left one side of her body paralyzed. Still, that hasn't stopped her from living her life, becoming a doctoral student and raising 3 children. In 2006, a bullet entered a policeman's face in the right temple and exited the left side of his head. The bullet blinded him, and he was forced to endure more than 30 surgeries, including tracheotomy and reconstruction of his face. A bullet entered a man's neck, cutting into his artery and embedding fragments of bone into his spinal cord. The shooting left him paralyzed. He has no feeling from the chest down but retains movement in his arms.